My name is Sabina Saiti, a resident of Kwale County and a sociologist by profession. My journey into the healthcare sector started by participating in a KEMRI to make a research project as a team leader for clinical research on elimination of intestinal worms in Kwale County. And from there, that is what propelled me to join the WASH sector, where I trained as a practitioner in community-led total sanitation in achieving an open defecation-free society. So what excited me more to join the CLTS is more on the use of local resources in achieving sanitation, which is a big drift from the over-reliance on external donor funding to support sanitation initiatives within the communities which are not productive, which are also not sustainable. So from being in the CLTS space, I've always had a bias in gender issues, and that is how I got myself into learning more on sexual and reproductive health and rights, and also responding and prevention of sexual and gender-based violence. So through my engagement in my interest to work in the gender spaces, I realized we cannot rely on handouts, we cannot rely on charity every day to support women. We need to do more on something that is, we need to find ways of establishing sustainable means. So I looked at charity and the different initiatives are not enough, because as non-state actors will come in to support and go, the community will still remain with the same challenges. So I felt like I need to venture into the policy space, because policies are more sustainable, because it's about government supporting. We have clear policies, guidelines, laws that push the government to address the issues that we have within our societies. So I have been more interested in policy issues, and that is how I got myself to work more in the health sector, where I have been part of the policy shaping conversations, where I have already participated in the reviewing of the draft National Sanitation Management Policy. I've also participated in reviewing and also inputting into the Kwale County Gender Bill on prevention and response to sexual and gender-based violence. I've also supported many other non-governmental organizations in developing policies with respect to integrating gender issues in the same. I'm also looking at how do we prepare the health workforce to also work best on integrating gender issues and policy issues in the healthcare sector. So as my part-time engagement, I also teach at a medical college with a specific focus on community health, where I teach my students on gender and disability mainstreaming and also sustainability mechanisms for community health. And this, I go further by not letting my students just learn on gender issues within the society, not just as receivers of health policies and guidelines and programs within the community, but also how do they get into shaping the policy conversation such that they are able to integrate these issues at the policy level, decision, at the policy design, at the policy shaping level, not waiting to be receivers of policy to implement the policies and guidelines without them having input into the document. So I still look forward into working more into the health sector, as I've also been building my own capacity in through training and different professional courses in health system strengthening. And I'm looking at how do we build sustainable systems that are more reliant on domestic resource mobilization, as we are all aware that we have shrinking donor funding in sub-Saharan Africa. So we need to find ways which are sustainable, and the only sustainable ways are domestic resource mobilization, domestic policy influencing, the shaping, the designing, the implementation of all these policy issues. And I'm also looking into the health financing aspect, because it's a key area that we are looking at as a country. We are having a conversation on universal health care, and we're looking at how possible is it for the grassroots communities. What does that mean, universal health care? How do they access universal health care? So it all goes into the health system financing by the government agencies, by donor agencies, by local partners within the country. And I'm also looking at how do we make it a reality. for the grassroots community? How do we also bring the gender lens into the universal health care? And this is something that we are already doing in Kwale County as partners in the health sector. We've already shaped discussions in gender lens when it comes to health issues, and you look at it's among the counties where the medical examination for survivors of sexual and gender-based violence, the fee is waived, so it's free access of medical examination. We are also looking into how do we prepare communities, because if you look at this is not just a duty for the government and other developing agencies. It's about what roles do citizens play. So here we are also building the capacities of grassroots women to advocate for the addition of maternity services, even at the lowest level of healthcare, at the dispensaries, at the health centers, addition of maternity wings, addition of reproductive health services for women, and maternity health care. So these are conversations that we are looking at, not just influencing the government agencies and other donor agencies, but also how do we shape the conversations of grassroots women and men to be able to respond to the needs of women largely, which is the vulnerable gender. I feel that more development partners in the health sector, government agencies, need to invest more on building the capacities of communities to participate in policy decisions regarding health, because we realize this is a role that has been left to a few individuals or partners who are in the development space who are aware. How about incorporating this conversation by including or by setting up platforms for the participation of grassroots communities to participate in shaping the health agenda, such that it's responsive to the needs of women and girls in sub-Saharan Africa. And I'm also looking at how do we also not just giving them a platform to participate, how do we also make sure that their voices count in the policy decisions? How do we make sure that their voices count in the design and implementation of guidelines? How do we make sure that their voices count even in the legislations that we pass when it comes to the gender issues? And this is something that, this is a call to all actors, and especially the government agencies, to ensure that whatever regulations, whatever policies we are passing are responsive, they are gender responsive, and not just passing policy, but also even in our budgetary allocations and planning, let us make sure that we have an additional budget that exclusively responds to the needs of women and girls.